Three primary reasons I want you to work around the sternum, and we'll go over and break them down into detail, but let's list them out. Number one, big fascial connection of connective tissue in the body. Number two, huge gathering point for inflammation because there's stagnation in the blood flow, arteries, veins, and lymphatics, and the endpoints of nerves there get inflammation and you feel pain. Number three, emotional tightness and tension in there because of closing down, pulling away from the world, causing emotional withdrawal. This is a front view of the body. You're going to have the sternum, your chest bone / breastbone, and then your rib articulations. What I want you to see is how the ribs wrap around here from the spine, and when they attach in towards that sternum, you can see the tissue changes, okay? But look at the spaces in between. Those are called intercostal spaces, and you have muscles that sit in between there. They can get tight and restricted, tense and tight from any number of reasons. I mean, poor breathing patterns is a big one. Poor posture is another one. And you'll see where I'm going to demonstrate that in a moment. But I want you to notice how the rib spaces actually change angles a little bit as you go down, and the spaces get smaller. So you're going to have to change your finger placement when you go along with the demonstration I'm going to show you in a moment when you begin to work on yourself. The first place that you're going to need to find is the space that sits underneath this area here, which is that first rib that you see here. And then you're going to have the second rib coming down below. You can see that they're numbered right here, 1 through 12. Right. That first space, the first three are really, really tight on a lot of people, especially if they have issues in the head, neck, and face. But I want you to watch the center here. When you work not only the spaces in between the ribs, you make sure you do both sides. If you find a lot of puffiness, tenderness, and swelling in the center here, that means a long-standing, deep circulation, lymphatic node, lymph node waste management problem that you've likely had for decades. So you want to clear this area out quick, fast, and in a hurry, all right? And it's going to take you quite a while to work on this, and I will tell you the following day after you work on this region is probably going to be pretty sore. All right, but that's normal. Now let's take a look at the little bit of the muscular sections in between. So here's a different view. That's the sternum. This is a breakout picture here of in between the ribs here. Okay? You're going to have the intercostal muscles. Now running in between here, you're going to have nerves, arteries, vein, and lymphatic fluid. Okay, and this is right where we're going to be rubbing is up against the sternum itself in between the rib spaces. You can work your way out a little bit too if you like. That's fine. But definitely go right up against that region all the way down. Okay. And now if I look at this next picture, this is a really, really zoomed up version of your sternum. So this is the top of the sternum, and this is the regular bottom of the sternum here. And look at the intercostal spaces. So you see here the ribs right here in blue that I'm coming around. And remember, the bone doesn't go all the way and attach to the sternum. That's a different type of tissue here. But look at this represented in colors here. You see the green? Those are lymphatics. And when this area gets really tense and tight, the lymph gets congested here, and that's where some of the puffiness and the swelling and the inflammation come from, and it backflows in towards the sternum. Then you see these intercostal nerves wrapping around here as well. And where do those nerves start? They start in the back. They go along your spine. So one thing that you may notice is when this area is puffy, tender, swollen, or inflamed, you may get pain in the middle of the back because that's where the nerves start. Look at the blue. The blue represents veins. They take the blood flow back towards the lungs and heart so it can circulate out again and towards what? The red, which you see here, and that's your endpoints of the blood flow. You have your arteries, then you have arterioles, and then you have some capillaries. because these big pipes just change sizes and they change names as they go along, but it's still the same pipe. And if you put your finger in here and it's really painful and you feel like you want to punch somebody in the face when you rub here because it hurts, that's not normal. It's not supposed to be painful in here. And it's going to surprise many of you how this can be just awful. But that's a sign that you need to be working this area and work both sides all the way down and then do the other side. I don't care which side you start with first, as long as you do both and work them every single day until they're no longer tender, which can take you weeks or months to get there. Okay, everybody, I'm here with Fred, my demo skeleton, who's going to help us out a little bit to orient what you're looking at here as opposed to just seeing the graphic pictures that we showed you before. This is your sternum in the center, your right collarbone, your left collarbone, your ribs wrapping around here to attach to the spine in the back, right here. And you have your intercostal spaces. This is where I want you to be rubbing in between where the ribs attach at the sternum. So I want where all three come together. Finding that first space, pretty simple to do. Find these two big bones right here called your sternoclavicular joint. This what's called proximal portion of your collarbone or your clavicle. Then come down till you fill that big hole space and rub right there. Then work your way down each space all the way towards the bottom until it ends. What I want you to notice here is how big the spaces are up top, how small they are underneath. You're going to have to change the angle of your finger and the size of the spacing in there to reach them. But don't let the size fool you. These lower ones can be some of the more uncomfortable ones because nobody ever really pays attention down here, and you should. Then do the same thing on the other side, working all the way down, noting how one side feels compared to the other side. You always want to work both sides. But this is going to free up the nerve, artery, vein, lymphatics, and tight tissue and inflammation here, and also help the fascia that bridges, that connective tissue that bridges from your left pec to your right pec across, as well as the fascia that goes all the way down, honestly, towards your feet from your neck. So you'll free this area up. And then if you want to add going straight in the middle of the sternum like this, right in the middle of it, and free up any puffiness and tenderness and any swelling in here, because it should not be painful on the sternum. If you have puffiness, tenderness, swelling, or inflammation here, that means you've got some deep lymphatics and deep blood flow blocks that have been behind the rib cage here for a long period of time. So you definitely want to be working those out. Give them a go. Let us know how it works. Here's another perspective of working on the sternum. What I like to do is take my two hands, put the fingernails back to back, then place them right here at the top of the sternum. Go up and down and side to side, working your way all the way towards the bottom until it ends right at the beginning of the top of the abdominal muscles called your rectus abdominis. Okay? Do that a couple of times. Then if you look here, you've got the collarbone, the clavicle. If I slide up underneath there, I'm going to find that first spot right there. And I put my fingers in the space between the two ribs and right next to the sternum, then slide down to the next space and rub there, slide down to the next one and rub there, all the way underneath to where the rib cage angle changes by the pectoral and the breast tissue that you'll have to move out of the way. Then do the same thing on the other side. Switching fingers, you'll find which one works well for you. And go all the way down and underneath. All right, let's take a closer look at the fascial connection. You have right shoulder, you have left shoulder, right pectoral, left pectoral. They have to cross bridge with each other all along the sternum. You also have fascia that connects one shoulder across to the opposite side hip in this X-type pattern. That's because you can do this thing called walking. Whenever you move one arm, another leg goes with it. Okay? You also have connection of fascia along the front part of the body, from the chin and the neck, going all the way down the front to the pubic bone, even in at your feet. That's called your superficial front fascial line from Thomas Myers and anatomy trains. Now let's talk about the fluid flow, the systems there. Along the sternum here, you've got a gathering of end points of arteries, veins, lymphatics, and nerves. When the fascia gets really, really tense in there, that clamps down on that blood flow when you get stagnation in those regions, causing inflammation. Many people don't even know they have inflammation in that region until they put their fingers in there, like you're going to see in a moment, and it hurts. That's a universal sign of inflammation, pain. They need to go in there and start working that region. So freeing up this fluid flow in here makes a huge difference everywhere in the body. Number 3, emotional. So this area is, of course, where your heart sits, and some people may call it your heart chakra or your energy channel. But this area gets tight when you withdraw from the world. When you're trying to curl away into what they call a fetal position like this, notice what happens if you curl inwards, moving away from the world. Everything in the front tightens up. So your pecs get tight. Your shoulders get closer together. Your shoulders get closer with your hips, and your neck comes closer to your chest. So all of that stuff that we mentioned in the beginning of the fascia becomes compressed. And when that becomes compressed, that chokes off the fluid flow in that region, and you can get inflammation there. But you also are trying to curl away from the world, and this is the energy channel of the body. So if you look up on the internet, you talk about heart energy, you'll be able to see that there's a radius that is around you of your heart energy going outwards. It's quite far. And you can pick that up on another human being when you come into their radius, especially when you get good at your own self-awareness of paying close attention to the world around you. And a few things are going to happen to you when you work this area of the sternum. 1, you're going to free up the motion in that blood flow, lymph flow, and the arteries. There are a few things going to happen to you when you release this area of the sternum, like we're going to show you. Well, 1, you're going to decrease tension in here. You're going to improve blood flow in, blood flow out, and lymphatic flow, so the nerves are actually going to function better. You'll feel like you're standing tall, lean, mean, and confident, so you'll open yourself up to the world. So maybe you'll feel a little bit better emotionally, because when you change your posture, you change how you feel. When you change how you feel, you change your posture. It goes both ways. So now you'll be standing up maybe a little tall, lean, mean, and confident. I feel it. Opening up into what they call extension, expressing yourself out into the world because you worked in this particular region. All good stuff.